So, what is the diagnosis of this question? It is acute suppurative otitis media. What is ASOM? What is otitis media? It is acute inflammation of the mucous membrane lining the middle ear cleft. The middle ear cleft comprises of the eustachian tube, the tympanic cavity, the mastoid antrum, and the mastoid ASL. So, what causes acute suppurative otitis media? Acute suppurative otitis media is caused by bacteria, viruses, and also there are environmental, allergic, and genetic factors coming into play. The bacteria, the most common organism causing ASOM is Streptococcus pneumoniae, H. influenza, and Moraxella catarrhalis. After we have introduced like conjugate pneumococcal vaccine, non-vaccine subtypes also have evolved that causes ASOM. Viruses you have respiratory syncytial virus, influenza virus, adenovirus, rhinovirus, etc. You should know that the ASOM usually precedes a viral upper respiratory infection, and usually the middle ear is infected via the eustachian tube that ventilates the middle ear. So it is more common in children because their eustachian tube is shorter and horizontal. Also, children have other risk factors like children with cleft palate, adenoid hypertrophy, immunodeficiencies, vitamin A deficiency, children who are not breastfed. The breastfeeding protects against development of acute suppurative otitis media because it contains lot of immunoglobulins. Then children who are from the lower socioeconomic status are also prone to develop more ASOM. Nowadays, ASM is also seen in adults. When I was studying, it was more frequent in children, but now I see in clinical practice more adults getting ASM, maybe due to the antimicrobial resistance or something. What is the pathophysiology of ASM? How is ASM formed? So after when you know that the middle ear space is a very concentrated space, the epidiameter is only around 10 millimeter. So when there is inflammation from the upper respiratory infection, there is edema of the mucosa of the eustachian tube, and there is blockage of the eustachian tube at the most narrowest part. So once the eustachian tube is blocked, the ventilation of the middle ear is blocked. So that is the first stage, that is known as stage of tubal occlusion or stage of hyperemia. The ventilation of the middle ear is blocked and the tube is occluded and there is inflammation of the mucosa. At this time, if you use an otoscope and see the tympanic membrane, you can see that there is a dilated blood vessels around the handle of Malleus and around the rim of the tympanic membrane. Second stage, what happens is the ventilation is obstructed. So there is negative pressure in the middle ear because there is no air coming in. So then there will be exudates. They come out from the inflamed mucosa due to the negative pressure, and the exudate fills the middle ear. That is the stage of exudation or stage of pre-suppuration. That's the second stage of acute suppurative otitis media. In this time, the patient will have ear pain, ear fullness, fever. So when you see with an otoscope, you can see that the TM is bulged and all the landmarks of the TM is lost. The TM can be red and congested also. That is stage of pre-suppuration. Then what happens is there is fluid in the middle ear. So the bacteria and viruses will colonize the fluid and it becomes infected. So it becomes suppurated, then it becomes purulent, it becomes pus. That is stage of suppuration. That is stage 3, stage of suppuration. At this time, the child or the person who is affected, the patient will have severe ear pain, ear blocked sensation. The TM will be bulging and the middle ear cavity will be under pressure. At this time, the TM can perforate. Usually, the perforation occurs at the antero-inferior quadrant, and the serous or serous-angulus or the purulent discharge is discharged into the external aortic canal. Once the perforation occurs and the pressure is reduced, the ear pain or the otalgia will come down. The fourth stage is stage of resolution or stage of complication. So this depends. Stage of resolution is the patient is coming to you, you are giving the patient medication. So the stage of resolution depends upon the virulence of the organism, the immunocompetency of the patient, and also the effectiveness of the antibiotic or the treatment prescribed. So if the patient is immunocompromised or if it is a highly virulent organism and antibiotics are resistant, then the infection can progress into complications. So if a small perforation has occurred due to an ASOM, usually it will heal with your treatments. How do you diagnose an ASOM? The diagnosis is mostly clinical diagnosis that you get from the history of upper respiratory infection, history of ear pain, fever, ear block sensation, all this will be there. And otoscopy examination will show you findings like hyperemia of blood vessels or fluid or pus behind the eardrum, bulging eardrum, red eardrum, loss of all landmarks for eardrum. It is acute suppurative otitis media. Be careful that in young children, they can present with not the typical symptoms. Like they can present with incessant cry, not sleeping properly, rubbing the ears, vomiting, diarrhea. All this, if a child is coming to emergency with all these symptoms, be sure that you see the ears so that you don't miss an acute suppurative otitis media. So, what are the complications if we are not taking proper treatment, or the treatment is not adequate, or if the person's immune system is low and the virulence of the organism is high and the person is not responding, this will go into stage of complications. So, complications detail I will be taking in another class. I will outline the complications of ASM. So, the ear is in the temporal bone. So you have complications that happen in the temporal bone and complications due to spread of the infection into the brain and into the neck. So in the temporal bone, you can cause mastoiditis. That is a minimal amount of mastoiditis will be there during the ASIM also. But then when the mastoid is fully involved and the septum of the mastoid is resolved and it goes into a subperiosteal abscess. So acute mastoiditis, subperiosteal abscess, coalescent mastoiditis. Then it can involve the inner ear causing labyrinthitis. Then petrositis. Petrositis is your Cardingo syndrome. This can happen. Then the pus can percolate from the mastoid into the neck, causing neck abscesses known as basalt abscess, lux abscess, Titeli abscess. Or you can also have post-auricular abscess. Then intracranial complication, the infection spreads in the brain causing meningitis, brain abscess, lateral sinus thrombophlebitis. Then you have otitic hydrocephalus, extradural abscess, etc. Details of these complications I will be reading in the next class. Thank you.